Hey Francine, I'm Sheryl Manspile. I work up on 5 East, and I wanted to talk to you about whiteboards and the fact that they can be so effective and such a strong communication tool between patients, nurses, other staff, as well as doctors. The whiteboards really are a consistent communication tool, and if they're updated regularly, such as at bedside rounding and throughout the day, and they involve the patient and the family in updating the board every day. This really does improve patient outcomes. When I say updating the board or getting patients to be part of the board and list their goals, things like asking Mr. Doe, what would you like to be your goal for today? And he can add on there, to work with PT, to be able to walk across the room, whatever it is. Can also write for the plan for the day. You have a nephrology consult that will happen today, or you have surgery today. Of course, the basics will be on there, such as the nurse's name, the doctor's name, and how to get in touch with the doctor. We may put family numbers on there. We may put allergies on there. They also can have notes on there for the ancillary staff, such as up with one assist or must use thickener in liquids. This will help, again, communicate to other staff who help out this patient's needs or limitations. Um, Barriers to the whiteboards are getting nurses to see it as a priority and to update it at the time of bedside rounding, and to involve the patient in updating the board. Other barriers are just having better boards that do not get smeared and are easier to read, and of course having pens that write, and it all appears neat. Other barriers are patients that may not be able to see the board because they do not have their glasses, or of course some patients who do not speak English. Evidence is showing that these whiteboards really are a consistent form of communication, and they do improve patient outcomes. Patients and families who feel like they have good communication with the nurses, the staff, and the doctors, um, they feel like their anxiety is lowered. Sometimes their physiological symptoms, such as blood pressure, glucose levels, are closer to baseline because they don't have that anxiety. They also are more apt to follow safety directions, such as calling for assist, calling before you get up, calling for help to the bathroom. So again, that is improving patient outcomes. For HCAHPS, this is a big question that they're asking as quality indicator. When they call patients, they're asking, can you rate your communication between you and your nurses? Again, if you have that board working for you consistently as a communications tool, this is one way that's going to make that HCAHPS score stronger, which is going to be cost effective for you in the long run. So in really getting these whiteboards up and running and training the nurses how to use them, and that they should be a priority, and that they'll work in the favor of the nurses because the communication level is better, patient outcomes will be better, families are involved. All of this definitely improves the outcome of the patient, and certainly makes communication with the staff stronger. I hope you'll consider getting new whiteboards and putting in a new training system for them. And thanks so much for listening to me.